Quick question. When your chest feels tight at 2 a.m., who do you turn to first? Your doctor, your partner, or that glowing chat box on your phone? If you whispered the chat, you're in good company. A new poll shows 1 in 4 American adults now run their health questions past an AI, sometimes before they talk to a doctor, sometimes after, and sometimes instead. Tonight, we're stepping inside that late-night chat window to hear what people are really asking and how much they trust the answers. Stick with me. By the end, you'll know exactly when this tech can help and when it's time to pick up the phone. Section 1. Why the AI confessional exists. Here's the thing. Those 2 a.m. chats aren't just curiosity, they're triage. Listeners are weighing 3 gut checks. Can this wait? Do I have to go in? Is it worth waking someone up? Money, work schedules, and memories of rushed 5-minute visits all push people toward a cheap, private second opinion. Think of it like checking the weather radar before a road trip. You're still driving, but you'd like to know if you need snow tires. Section 2. Who's chatting and when? First, younger adults. They're digital natives, sure, but they're also pasting entire discharge summaries into the chat and saying, "Give me 3 bullet points in plain English for tomorrow morning." Second, folks with chronic conditions. They dump weeks of blood pressure or glucose readings into a spreadsheet and ask the bot to spot trends their 10-minute appointments never touch. Third, rural users. Long drives, scarce specialists, high deductibles. Every mile and every dollar matters. They use AI to compare. Telehealth tonight, urgent care tomorrow, or wait for their primary doc next week. Section 3. How people actually use the answers. 1. The rehearsal studio. A parent drafts how to tell a doctor about a teen's eating changes. Someone with a new cancer diagnosis practices what to say at work. 2. The side effect whisper network. Embarrassing symptoms, drug reactions, lab results that never got explained. AI becomes the judgment-free friend who's awake at midnight. 3. The tiny tweak brainstorm. Instead of hearing, "Just exercise more," users ask, "Give me 3 back-friendly workouts I can squeeze in after a night shift on a tight budget." Section 4. Who's left out and what's being done? Not everyone can jump in. Slow broadband, limited data plans, low digital literacy, and language barriers shut some doors. In response, we're seeing clinic-based digital navigators, library workshops, and community health workers who walk people through their first chat so they don't need the latest phone. Section 5. How clinicians are responding. Some doctors now invite patients to bring printouts or screenshots. They treat the AI output like a starting hypothesis, something they can confirm, refine, or, when needed, shut down hard. On the back end, health systems are testing similar tools to write plainer after-visit summaries and first-pass discharge instructions, freeing up nurses for real conversation. Section 6. The bigger picture. Imagine millions of anonymous 2 a.m. questions forming a heat map. Planners can spot pockets of untreated pain, side effects that never reach a chart, and school night panic over a kid's breathing. Just as cities redesign streets after tracking traffic jams, health systems could shift hours, staffing, and services to where life is already flowing. Section 7. A quick gut check for you. Before next week, try this mini exercise. 1. Think back to the last time you typed symptoms into an AI. What were you really hoping for? Speed, privacy, a gut check, and did you get it? 2. If you printed that chat and took it to your next appointment, what 2 questions would you want your clinician to clarify? 3. Pick one boundary right now. Maybe, "I'll use AI for explanations, but any decision about starting or stopping meds happens with my doctor." How will you remind yourself of that when the screen is glowing at 2 a.m.? Let that sink in for a second.
Recap. So, what did we learn?
So here's what we covered today. First, 1 in 4 American adults is quietly turning to AI for health advice, mostly as a triage tool, not a replacement. Second, younger users, people with chronic conditions, and rural residents lean on it the most, each for slightly different reasons. Third, the tech shows up as a rehearsal studio, a side effect whisper network, and a brainstorming buddy for small, realistic health tweaks. Fourth, gaps remain. Broadband, language, and digital literacy can slam the door on those who might benefit most. And finally, clinicians and health systems are starting to meet patients halfway, using AI themselves and inviting its printouts into the exam room. Why does this matter to you? Because the next time a symptom pops up, you'll know exactly where AI fits in your personal playbook, and when it's time to call a pro. Thanks for listening. If this episode helped you draw your own boundary lines, share it with a friend who's up scrolling WebMD right now. Until next time, stay curious and stay healthy.